Good afternoon, everyone. So, impression cytology has been one of the diagnostic technique for diagnosis of OSSS. It's basically the indication of being various ocular surface disease like keratoconus sicca, pemphigoid, vitamin deficiency, and it is one of the modality for diagnosis as well as follow-up of cases of ocular surface squamous neoplasia. So what generally one of the study has quoted almost it has got a 70 to 80% positive predictive accuracy for diagnosis. That is the impression cytology. It allows the collection of epithelial cells from the surface with a minimal discomfort to the patient, and also the advantage it has that is it does help in preservation of limbal stem cells. So essentially, what we do in impression cytology is we collect the superficial cells from the surface, send it for either histological analysis or depending on diagnosis, either for immunohistological analysis and at some places for molecular analysis. The various stains which are used for impression cytology is PAP stain, or also known as papinicularis stain, hematoxylin and eosin stain, and PAS stain. Various collecting devices are used for the collecting cells from the surface are mostly used a cellulose acid filter paper, and one of the literature says a biopore membrane. We did not have access to this, any cellulose acid filter paper or any biopore membrane. So we went ahead and devised one technique, that is collection of cells from the surface using easily available cover slip, which is easily available in the lab. So the various requisites are just on the glass, the speculum, cover slip is easily available in the lab. The tissue is taken from the OSSN under paracan. If the patient is comfortable, if the patient is cooperative, it can be done without paracan also, and it is plated on the slide. And after that, the job of pathologist, she can do the staining. In this case, the PAP stain was done, which showed dysplasia in this patient. So this is a pre-procedure photograph of the patient, OSSN, and post-procedure photograph. Stain was used a PAP stain. After this diagnosis, the patient was treated with interferon alpha 2b in the dosage of 1 millunit per ml for almost 6 weeks, and there was there was no OSSN after 6 weeks. So coming to the advantage this technique has, it is very cost effective. There is hardly any cost involved. Cover slip is easily available in any lab, easily available, and there is no technical expertise required in this. Thank you.
Very nice. Very simple, easy way.
Please give
Loud, Bob, with mic, please.
Very nice presentation. But how do you think that how safe it is to use a cover slip? Because sometimes we see OSSN, like they are in the melting stage. So you're using a cover slip. So how safe it is for the patient?
Maybe normally if you go deep, then it is at times it might bleed. But in this case, I was very superficial, and
so it needs technical expertise. Like it's not that it is a reproducible surgery a technique anyone can do it. So
normally, I mean, technical expertise means resident can do. Even resident also can do. So that is it.
Good.
Oh, thank you.
Thank you.
I had one question.
Yes.
Sir.
Recently done without paraffin as well.
Sir,
Why would you do it without paraffin?
I tried with.
Paraffin changed the diagnosis.
No, sir. What was the?
Why would you keep the
Why not keep the patient comfortable?
Yeah, is it possible? What I said that it can be done without paracan also if the patient is cooperative. At times, if the patient non-cooperative.